So just quickly, I'm going to try and get through this quickly. Scotland has the highest rate of fatal injuries at work. Scotland and Wales have the highest rate of far more than England. In Scotland, you're still between half and a third more likely to be killed at work than you are in England. The costs of occupational ill health and injury, which is not touched on today, over the last 5 years has amounted to over £100 billion. It's roughly about £1.8 billion in Scotland alone. Work-related health, as we've been touching on today, actually outstrips the cost of physical injury. Workers who are made ill or injured at work and their families carry most of the cost in relation to these experiences. It's roughly 60% falls on the individuals, mainly through loss of earnings. 21% falls on the government, and 19%, the lowest share, falls on the employers, and that's something we have to address as well. HSE grant funding since 2009-2010 it was 239,000. In 2020 it was 121,000, roughly half of what it was when the Tories came to power. And the latest accounts show they received 167 million from the DWP, but it's very hard to find a reference to the fact that potentially around 30 or 40 million of that is in relation to the building standards regulation in England, which they've taken over responsibility for. That not in Scotland, so we have to ask questions of the HSE, is how is a third of their, potentially a quarter of their funding going on something that is not work related. I don't think Simon's grandfather envisaged that happening, that has to be said. So we have for a long time lobbied for devolution of health and safety, and I think we have to up that, the strength of that lobbying, so we can have health and safety devolved and start to address some of the issues that are emerging in the HSE and the way it's controlled by the government. NHS Occupational Health Service, Ewan's talked about this, but I think one important thing is to go back to the Carol Black review, and I have mixed views on the Carol Black review, but the more you read it all these years later, there are some good and very valid points that have not been introduced, unfortunately. And the Faculty of Occupational Medicine and the Society of Occupational Medicine said at the time, a major obstacle to the provision of effective occupational health services for all is the historical exclusion of occupational health services from the remit of the National Health Service. Again, I spoke at something that Ewan organised, or Simon organised, last week, and we keep mentioning this figure of 45-50% people of workers having access to occupational health services. It depends on what they're actually getting access to. You can have access to very comprehensive occupational health services, or you can have access to the basic minimum, which is your sickness absence management and managing people out the door. And we see if you have access to comprehensive occupational health services, then that is likely to be far less. 2004, the HSE did a major piece of work, and it was they estimated that had to be about 4%. So we need to do work in relation to improving the Scottish Government's record, which is not going to be hard, as we said, but in relation to what they're doing on occupational health. 1995, Lothian Occupational Health Project had health and safety advisors going into doctor surgeries. 30 years later, we're no further forward. In fact, we're probably going back the way in relation to community involvement in occupational health. So we will continue to lobby the Scottish Government and work with them to try and improve occupational health and food. Scottish Hazard Centre, Tilly's covered that, I think, in relation to what we're doing in the lead. Sorry.
You've gone the wrong way.
I've got bad eyesight, as I say. Fair work. No, we're clear that fair work cannot exist where that work is neither healthy or safe. And I think we can all say that, you know, there are times when we have to say, if we apply that to our own workplaces, then are we really enjoying fair work? The health and safety is definitely connected to effective voice, and that's why I think trade union health and safety reps have been so important, is because they provide their members with that voice in the workplace. But far too often in non-unionised workplaces, they don't have that voice, and that's where we actually step in. We were always trying to encourage people to join trade unions where that's appropriate. Again, how can we genuinely attain fair work if we don't have the support of workplace health and safety regulators to help health and safety reps and interact when there are problems? You know, we need more worker involvement in public procurement, you know, which involves at every stage of the process, from identifying where there is a need for procurement or where that work could be done in different ways, providing fairer employment, and, you know, really right through to being involved in the decisions about who gets that contract. You know, and obviously I think we've got big interest in just transition at the moment, and what we have to remember, and the SDUC are doing a lot of work in relation to this, but what we have to remember, we cannot let this be another oil industry where trade unions don't have a voice in the development of how our energy is produced and how it's produced safely. It only took 14 years from Piper Alpha coming on stream and producing oil to obviously 1988 with that tragedy, and during that time that oil industry was massively anti-trade union. Toxic use reduction, you know, I think we have a commitment to reduce, we are asking a commitment to reduce exposure in our workplaces, homes and communities, and there is a workshop on this afternoon. We have to focus on the most effective controls, but focus at the top of the hierarchy in relation to elimination and substitution. I think COVID shows many people, many policy makers placed their confidence in PPE, and that was massively misplaced. Culpable homicide, we have the most ineffective culpable or corporate homicide legislation. The political will or lack of political will has been absolutely astounding. We've worked with all these cases over the years where, you know, we have to question why corporate homicide charges were not laid. But then, you know, as Louise and I have both heard from the Crown Office, they prefer to go for a safe trial, you know, which is, you know,
a good plea. Rather
a good plea. So they bargain, and they don't like the word plea bargain, they don't like the phrase plea bargain, but they tend to go for a agreed plea on health and safety charges rather than testing the legislation and providing that justice for families. National Care Service. Clearly the National Care Service process last time was a farce. There was not enough engagement with trade unions. We need to look at it again. I was looking at issues, I was looking at the situation in Scandinavian countries again. You know, the fact they have more accessible free social care than the rest of the world, basically. So yes, it would be a cost, and at this stage, you know, a shout out to all the Unison members up in Aberdeenshire that are fighting back against that ludicrous decision from Aberdeenshire Council Joint Integration Board to massively hike the fees of social care and care at home. So, you know, we need to, I think, return to the aspirations for a national care service, but it has to be in consultation with trade unions. Right, I'm going to stop there, and obviously you can access our draft manifesto at that QR code. Thanks.